There's this quiet moment for a lot of women where their body just stops feeling like it's their own. You're doing all the right things, working out, eating well, pushing through, but the pain and the fatigue and the weird hormonal shifts just keep showing up anyway. And the frustrating part, everyone's telling you it's stress, motherhood, or aging. But pain after motherhood isn't normal, and constant tension isn't normal. Feeling disconnected from your body is not normal. Today, we're talking about what's really happening from postpartum through perimenopause and how alignment and hormones impact everything from anxiety to joint pain. So, what are my options to start feeling like myself again? I'm joined by women's health chiropractor, Dr. Shara Posner, to unpack it all with you. Hi, Shara. How are you? Thanks for joining us.
Thank you so much for having me.
I'm so glad you're here. So Shara is in the DC area with us, and I've known Shara for years, and it's one of those things where she is so honest. Blame it on the New Jersey. She is so honest and straightforward that when someone brings a challenge physically to her as a chiropractor, as a specialist in women's health, there's no holds barred with her, whether it's conversation or whether it's actual hands-on help. So, Shara, how did you get into this work? How did you start into this?
When I was a student athlete in high school, I had a lot of experience with trainers because, I was constantly injuring myself, like broke my nose, broke my fingers. Oh, yeah. Actually broke my nose twice. I wanted to do something to give back to people who were uncomfortable. So my uncle happened to practice. I went to University of Maryland, and my uncle happened to be a practicing internist in Burke, Virginia. And he connected me with a chiropractor in Burke as well, down the street from his office.
Yeah.
So when I was a freshman at the University of Maryland, I was driving out to Burke and spending days just following around the doctor and watching him work with patients. And I thought, man, this is so cool. People were coming in and they're like crippled over in pain, and they're walking out high-fiving him.
Yeah.
And he didn't prescribe any medication. And he did all the work with his hands. And I thought, wow, I feel like I could do that. And that's kind of how it got started. When I was in chiropractic school, I was at a party, and I was like, I'm going to find a sober guy I'm going to find the sober guy to work on me. And the sober guy actually injured me. So then I started going to the clinic. And when I was there, the chiropractor who was working on me for credit hours to get his license in chiropractic, he healed migraines that I had been having all throughout college. And I thought, wow, okay, now I'm sold, right?
Yes. Yeah.
So yeah, while I was there and I was getting my degree, I realized that, chiropractic is fantastic and it can help a lot of things, but there are other things that I'm interested in, and nutrition was one of them. So I then I was working in tangent on my doctorate as well as my master's in nutrition. So in 2004, I graduated with my master's of nutrition and my doctorate of chiropractic.
It is really cool to be, the body doesn't lie. You and I know that both, that like working in that physical health space is like when there's referral pain. It's amazing where a client will come in with a hip pain, and that is long-term shoulder injury that they never address and things like that. And when you can get your hands in there and show them the referral patterns or where the nervous system has been affected by, continuous work, it's pretty incredible overall. So
super fun. Mm-hmm.
Yeah, it was like, it's one of those things, like you said, a lot of times we're being given pills, right? We're being given, anti-inflammatories, things like that, but we're never addressing the heart of what's going on in the body, which is generally misalignment, and it could be as, sitting behind a desk, or, I tripped and fell, or whatever the case may be, or more recently, I fell on the ice. I get that one a lot. And I'm like, let's talk about your alignment. Let's talk about what's going on with your body right now. But you actually specialize in the female space, which is why I love talking to you.
Right. Well, I think, when you get into practice and you kind of are working on clients, I don't know, I'm very passionate about me. So,
same.
Right? So
yeah.
I'm
I'd like to thank me.
I like to thank me, just like Snoop Dogg. But no, I'm very passionate about like the things that I'm going through and the things that I experience. And I also feel like when you're talking about something that you've experienced personally, you can speak from a place of passion, which, people can get on board with. And so I have found that in the 21 years of practice, the avatar in my practice is me. So it's like, they had children. Now it's the focus is on women that are like perimenopausal, menopausal, like frozen shoulders, that kind of stuff. But all of the women in my practice, at some point I was there and experienced that. So I can come from a place of understanding that I know what they're going through.
Yeah.
I've solved that problem for me. And so I'd like to help solve that problem for them as well.
Yeah. Yeah. And that you do. And I think that's so important is this is a place for women to go. Your office is always fun. It's always entertaining, but it's very female focused because we know, and you said it yourself, a lot of times we go into a doctor's office and someone hasn't had the same experiences we have. So they get the WW label, right?
Yes. The whiny
Yeah.
women.
The
Yeah.
whiny women, right? Exactly. And it does come down to, and you talked about this very distinctly, that a lot of the studies, a lot of the things that we're learning about hormones or things that came out in the past were not actually done on women, were not tested or studied on women. It was a variation of male data, right?
Yes. Right.
What are you seeing a lot in your practice now? I'm sure you're seeing pregnant women, you're seeing menopausal. Like what are generally what's going on?
So I do see a lot of pregnant women. I love pregnant women. There's not a lot when you're pregnant that can serve you. Those new studies just came out about Tylenol and autism. I don't know where you fall on the spectrum of that. It really doesn't matter. With the internet, our everyone is becoming a lot more learned, and they're also learning a lot more about trends and theories and belief systems. We're just consuming so much information. And so, I think that it's important to be able to address those issues with my patients. So we see a lot of pregnant women. They don't want to use Tylenol to make themselves feel better. They're exhibiting discomfort. More importantly, when you're talking about pregnancy and birth in
Yes.
general, the alignment of the pelvis is very important because there's a lot of structures in and around the uterus that insert into the pelvis or can create tension on the pelvis. So with good alignment, the idea is that you'll have very little discomfort when carrying a baby. The baby will position themselves appropriately. And more importantly, your labor and delivery, studies have shown, can be less uncomfortable as well as faster if you are getting chiropractic adjustments. So the pregnant women, that's why I love working with them, because I can help them in ways that they can't find help. And then the perimenopausal women, I like working with them a lot because they me. And so,
Yeah. Yes. Yes.
I'll go to the gym and like my shoulder's feeling really tight. And I'm like, next thing you know, I got 40-year-old shoulder. And that's
Mhm.
the perimenopausal estrogen thing. But there's a lot of different kinds of things that we can do in the office to help them with that. Also make the referrals for HRT, but musculoskeletal wise, we can get better motion into the joint. We can free up the restrictions in the joint, work on the muscles, and get them to loosen up so they're not so adhesed. Work on women who are having some problems with their core or the ability to maintain their core because of low back pain. They're going to the gym, they're lifting heavy, they throw their back out with a deadlift. All those kinds of things are things that I've experienced and things that I, think I can really help patients with. And because they're female, even more so, because I'm speaking from a place of experience. But that's not to say that I don't like to have the husbands in the practice too. The husbands are great. They
Yes.
normally get dragged in by the wives and then they love the adjustments and they stay, but
Yep.
they're
Yep.
great too. They're welcome to the practice as well.
Yep. Guilty. Guilty.
Yeah.
That is also my thing, right? I realize that something works and I'm like, well, I just volunteered you to be healthier and
Right,
happier
right,
now.
right.
You
Sometimes
won't
the husband
love it.
shows up and they're like, why am I here? I'm not sure why I'm here.
Thank
Uh-huh.
you for saying that it is really about the alignment, right? It really is about the body functioning optimally. And we don't realize that little inconsistencies in our day or weight distribution differences can make a huge impact. And I say this all the time when I'm working with clients that ignoring those signals is the worst thing you can do. So having a resource like you to go and have someone actually look at your joints, look at your spine, assess the alignment, make sure that we're not inconsistently distributed. These all go hand on hand. And who else doesn't want to have to take one extra pill, right?
Yeah,
Because
sure.
it's a temporary solution.
Yeah, I mean, it's the old adage, and it's the best reference that I have is, when I have some runners that come to the practice, and when you run and you're doing a lot of street running, you have the middle is domed because of runoff. You don't want water collecting in the street, and so it's always one leg's longer than the other when you're running,
Yes.
with traffic.
Yep.
And so that creates asymmetries. If you drove your car around out of alignment, your car, ultimately would break down. But in our case, our body's not breaking, I mean, sort of breaking down, but not really. But, you have to rotate those tires more often. You have to, because you're going to get abnormal wear and tear. And that's really what we're talking about. If you're sitting all day long and you're crossing your legs, or if you sleep on your side without a pillow between your knees, or you're on a soft couch and you're like really kind of tucking your pelvis underneath you, all of these things can cause structural anomalies, meaning stretching of ligaments or muscles get weak because they're put in constant tension. And so you can develop pain patterns because of that, or areas of weakness. So let's say you are sitting all day long and then you head to the gym and you're like, you kind of go back into the gym and you're like, I can start where I left off. And that's not how it works. So alignment is essential. Alignment is the foundation of my belief system. Even when we're talking on a cellular level, there needs to be good alignment in order to be able to receive the nutrition. There needs to be good alignment to receive the movement. There needs to be good alignment so that you can sleep well. Everything, all your ducks have to be in a row before you start to build on to other things.
Yeah. One of the pieces that we don't talk enough about is actually our central nervous system, right? And functionally, we've got our mental health, we've got our central nervous system, we've got our physical health, and they are all so tightly tied together. Like I said, body keeps the score. The body doesn't lie to us.
Right.
So even if we are imbalanced physically, it can manifest in anxious feelings or muscle tightness or an overreactive nervous system, right? So even though, you're treating the physical body, you're really also treating the nervous system. You are treating the mental health in a lot of ways too. And I think as we progress into our hormonal shifts, right, this is an element sometimes we forget, that body alignment, even though we're not powerlifting over or deadlifting, or over our heads anymore, there is a lot of benefits to assessing that alignment.
Right. Yeah. I mean, during our intakes or our questionnaires, I ask people, what's your diet look like? I want to understand what kind of movement are you putting in your body? How's your sleep? When you're working, are you sitting or are you standing? All these things lay out a picture of the kinds of stresses in your life. And if those stresses if there's a lot of them, there's a lot of input into that system, your central nervous system is not doing well. And giving people techniques that are so simple, just something like, when you wake up in the morning, doing some deep breath work, just to recenter yourself, just to kind of pull back the stressors so that you can then go out into the world and do it with a more even tone, is something that I think is, invaluable. A lot of people forget about the pillars of health. Turning people back to the focus on the pillars of health can really also, not even like with me touching their body, but can help them get back into alignment. Mm-hmm.
So one of the other things, and a lot of times as we get into our late 30s, 40s, and again, don't tell people when we graduated, that doesn't help us.
Yeah.
It's one of those things where it's really quick on our parts to assess that there is a hormone issue, right? It could be our central nervous system, could be our diet. I'm glad you said that. But we can't negate the fact that hormones are taking a place in our joint issues, our health, and something you and I have talked about a lot other than marital time in the morning. We'll get back to that. But can you tell me a little bit, because this is really a popular topic, is like peptides. That's something that's coming into your practice more, you're seeing more. Can you explain peptides?
So peptides are short chain amino acids that are basically pathway promoters. So, if you take a supplement, you're taking it because you have a deficiency,
Mm-hmm.
right? That's what supplements do is they supplement a deficiency. So I don't have enough magnesium in my diet and or my body, I take a magnesium pill. Whereas a peptide is a promoter of a pathway. So when you take a peptide, it tells your body to work harder and
Mm-hmm.
gives a signaling instruction to the body. So there's all different kinds of peptides, and peptides that we're most familiar with are GLPs.
Right. We're
GLPs
hearing
have
a
gotten
lot.
a
Yeah.
lot of press because they have done such amazing things for inflammation, diabetes, all of our like big heavy hitter diseases that people are developing later in life that are metabolic
Yes.
syndromes.
Yep.
It's reversed them. So because GLPs have become so popular and because they're so effective, we are now kind of observing these peptides that are in different arenas, which bodybuilders have been using for years,
Yep.
are
Yep.
now starting to come to surface too. Because we're like, well, if we can make you lose weight,
Mm-hmm.
what about the inflammation or recovery after a workout? What
Yes.
about the anxiety that starts in women when they are perimenopausal? Can we not take a drug, but can we take something that makes our own body work like it did when we were in our 20s? And that's the coolest thing about peptides is as you get older, your body ages and it doesn't work these pathways as strongly, or the pathways because your body's aging starts to break down, like collagen.
Yep. Okay.
So there's peptides that promote collagen.
Action? Is that what you mean? Like actually
Yeah.
gets you to, okay. Okay. Okay.
Yeah. So promotes collagen production so that you can actually use it for, making your skin look bright and help with inflammation. There's peptides. There's a topical peptide that's supposedly like the Botox peptide.
Okay.
So,
Say
I mean,
more. Yeah. Yeah.
peptides are really, really cool. And they're, like I said, they're getting a lot more press also because of the GLPs, but now also because of the MAHA movement and Kennedy.
Got it. What I love about talking to you is we talked about this before. Everything you do is something that you generally take on yourself first, where you're not a promoter of, oh, well, I heard about this thing on the internet and I want to show you. The cool thing about Shara, I always learn, is she is I'm going to take this on. I'm going to try this and see.
Right.
What do you know? Are you taking peptides? Are you doing
Yes.
anything with the peptides? Can you tell
Yes.
us about that?
So, I was experiencing perimenopausal symptoms. I was getting like hot flashes at night. I'd wake up. I have curly hair, and my hair would be curly, even though I'd straightened it because that's how sweaty I would get at night. Really unrealistic reactions to my husband's breathing.
Yeah.
And,
Sorry.
and so disproportionate reactions. So
Why are you
clearly,
chewing again? Yeah. Sorry.
like why do you use it? No, I'm just teasing. Not that bad, but what I mean. Like
Yeah.
just frustrations,
Yeah.
brain fog, a lot of these symptoms, and so. I went to a colleague not far from my office and she did an evaluation. She was like, I really think that you need some hormone therapy. So I said, sure, great, let's do it. So I started taking some HRT and I
Okay.
do a patch and a pill, and I
Patch.
also have some creams.
Yeah.
And it got me like 70% of the way.
Okay.
70% of the way. So like, I'm feeling a little bit better. I still am kind of like, grouchy right before my period. But what I noticed is that I was going to the gym 5 days a week. And I was eating about 120 grams of protein a day, which is a lot of protein. And I was sluggish and I was getting, in my definition, fluffy.
Okay. Okay.
So, like when you get that layer of like fluff over you and
Yeah.
you just feel like, bleh, that's how I felt.
Okay.
So, I have a friend who is a bodybuilder, and we would talk a little bit about peptides. I had started to hear a little bit about peptides through, the bodybuilding community, and I thought, wow, okay, well, let's see. There is an FDA approved peptide called Samorelin, which promotes a growth hormone pathway. And so, as you get older, as a female, you are making less growth hormone because you're not growing anymore, right? You're just
Right.
aging.
Yeah.
Aging. Yeah. And so, and so
It's the
I was,
echo that killed me. It was the
yeah.
echo. But go ahead. Yeah.
And so I thought, maybe this is because it's an FDA approved one. This is a
Yeah.
good start.
Good.
So I worked with a friend and then also my uncle who was that internist.
Yes. Yeah.
And he was like, yeah, you should try it. You should try it. So I went on, developed a relationship with a peptide company and I started there.
Okay.
And about 3 months in of taking this peptide, I had a few people say to me, hey, have you been on a cut? And
Okay.
so
Yeah.
I
We know
was
what that
like,
means. Yeah.
and so a cut, for our
Yep.
listeners who don't know, is when you start to cut back on your weight, and so you get more of the toning or the building that you've been doing underneath the fluff starts to
Hmm.
show more.
It's a
Um,
bodybuilder
it's
technique.
a
Yeah.
it's a bodybuilder
Yeah.
expression. And so people were like, are you on a cut? Or what have you been doing different? You look different. You look like you're really strong. And so I thought, okay, well, this is great. The side effects of this peptide was that I was sleeping like a baby. And so,
Oh. Oh.
if
Okay.
you take this growth hormone peptide at night, it
Yeah.
helps you with your sleep because
Wow.
you're promoting that pathway, the growth pathway at night, which is just like you would do when you're a teen. And so I was like, okay, well, this is great. So we started here. Let's
Yeah.
stop. Let's keep going, because in some
Yeah.
cases, more
Yeah.
is better. So then I kind of went into trying some peptides for my hair, skin, and nails. I'm not going to show you, but like the grow out is like crazy. It's almost like, what you have after you had a baby, but it's
Yep.
been like a few years where it's like,
Yep.
so that. And I think for the most part, I've always had pretty good skin and I do a lot of skincare, like microneedling and lasers and stuff like that. But people have been saying, your skin looks great. Like, what are you doing? Then I started doing some anti-inflammatory peptides. And for recovery, I had injured my back. I had done a deadlift, threw my back out, started taking these peptides, and my pain went away. So I was like, whoa, okay, this stuff is cool.
Yeah.
So, with any of these peptides, some of them you shouldn't be on forever. Some of them you can stay on for longer periods of time.
Thank
So,
you for saying that.
I took myself off some peptides and then I started to work on more kind of fundamental cellular based stuff. I probably should have started it the other way around
Yeah.
because the foundation of your body and healing is in the mitochondria. If you guys remember way back to science in high school, the
Yep.
mitochondria is the powerhouse cell of the body.
There's a whole
All
song. Yeah.
mitochondria does is make ATP, and ATP is needed for every chemical reaction in your body.
Yes.
So
Yeah.
when you are weak with your mitochondria, and your mitochondria over time becomes more damaged as aging happens, you're not doing these pathways appropriately. So then I was like, okay, let me stop all of this and let me work on the mitochondria. So I started taking some mitochondrial peptides, which I think a lot of people inadvertently start there because they're like, oh, I saw on TikTok NAD. I need to take
Yes.
NAD. And so
Yes.
people are inadvertently starting with the mitochondrial peptides, which is fantastic because that's really where you should start. Fix the cell first, then pile on. So I started with NAD and something called MOTS-C. And my energy level
Yeah.
was like, so that after lunch slump
Yeah.
where I was going for that second cup of coffee.
Third, fourth for me. Yeah. Sometimes. Yeah. Yeah.
Completely resolved. Completely
Wow.
resolved. And so I was like, and then also the NAD gives me a ton of clarity. Really good, like really just removes that brain fog. Did a whole cycle of that. And then I went on to a microdose of GLP.
Okay.
The microdose of GLP got rid of the fluff, got rid of the inflammation.
Yeah.
And now I have very good definition, very good tone. I'm in a place with my aesthetics that I'm
Yeah.
very happy. I feel great.
That's all of it, right? Like we just like, I don't need to look 20, although no, I'm just joking. But like the whole point is I don't need to be in pain. And I think that's one of those things as women, we're sold this idea that, well, that's the chapter of life you're in, or you already had a child. I mean, You probably remember moms when we were kids. You just had a
Yeah.
mom bod, right? Like you just
Yeah.
had the mom bod afterwards. And we're finally getting opportunities in science. I don't want to go back to that chapter. I don't need to look 20, but the idea of not needing to be in pain to prove my age is a whole different thing. Recently, we had the black box warning come off of the hormone replacement therapies.
Yes.
And, that's patches, that's pills, that's creams. Now, you and I are not experts in this particular field, but that's something that you have talked about or at least brought up with your own practitioner.
Yes. So, when you actually do look at the study has been debunked. There was a different type of estrogen that they were using that we don't use anymore. And so the estradiol patches are much more effective and they don't have the same warnings associated with. I think when you're working with a professional who's responsible, and that's the whole thing too, is it's like,
Yeah.
you can go on to a billion and one peptide companies or a billion and one different, gray market, Chinese
Right.
imported
Yes.
stuff and get all the meds that you want.
Consider the sources. Yeah. Yep.
But having a doctor monitor you and make sure that your blood indices, your values,
Thank you.
getting your biofeedback, finding out how you feel, how things are changing for you, and monitoring you throughout the process is the most essential part when you're doing any kind of peptide or hormone replacement work. If you go into a place that has peptides and you are given a menu where you can order your own peptides, unfortunately, I don't think that is medicine being practiced properly.
No.
There is not a single doctor that puts a medicine catalog in the waiting room and you open it up and you say, I think I need a Z-Pack.
Yeah, this is not a nail service, okay? This is
No,
not
no.
reflexology. This is not
Yeah,
your nails being done.
right.
I agree wholeheartedly. This is something I'm seeing, in my practice and working with people too, is they're asking me for suggestions. And my immediate response is, I have friends who do this, professionally. It's really irresponsible for me to say, oh, you know what? You need this or the other thing. But that's also what the internet does, right? We have to be really careful too, that we're
Well,
not
but I
just
think,
taking the
like
information.
in your capacity, right,
Yeah.
as you learn about these different types of things, right? And you have the bandwidth and or the knowledge base to be able to counsel people through these things. So, like if somebody is on a GLP, there
Yes.
may be things that you do that changes their workout,
Correct. Correct. Yeah.
because you have an understanding of what the GLP is and how the person needs to maintain their lean muscle mass. You're not going to put somebody with a GLP on a treadmill 5 days a week.
No, I'm just kidding. Yeah. So it was like, it is, this is a toolbox, right? So
Yes.
GLPs, the peptides, the hormone replacement therapies are part of your toolbox or can be part of your
Right.
toolbox. So if you are finding yourself deciding that just one of those things is the response that you need, it's something to consider, right? What tools do you need for this job? And also, what's your desired outcome? So, Shara, thank you. I love having these conversations
Thank
where we're
you so
like,
much for
hey, this
having
is real
me.
world experience.
Yeah.
I want to play a fun game. Are you up for
Okay.
this?
Let's do it.
Okay. I like to play a game called Snake Oil or Supplement. Tell me in your best practical sense, how do you feel about red light therapy?
Love it.
Cold plunge.
That's a meh.
Mhm,
And what I
mhm.
mean is this is a situational thing, right?
Yes.
So no for cold plunge after a workout.
Thank
Absolutely
you.
not. Okay.
Okay.
Especially if you're female. But yes to cold plunges.
Okay.
So cold plunges are great for inflammation. I think that they're really good for, for that specifically. But when you are, and I should qualify this by saying, when you're going to the gym trying to make bigger muscles
Yes.
and then you cut off the blood flow
Yep.
in a cold plunge
Yep.
after your workout, you've
Basic
just
science.
wasted the hour.
Basic science.
Yeah.
Good. I'm glad you said that. Also, caveat to what you said, I agree wholeheartedly. There are some benefits to cryotherapies and things like that.
Yes. Yes.
But as a woman,
Yes.
affecting your body, especially at different parts of your cycle,
Yes.
really, really do your research on that one.
Yes.
So unlike men who cycle their hormones every 24 hours,
Yes.
women do the 28-day if we're lucky. And so different parts of your cycle, on top of needing different workouts, also those sort of tools, not a go for women all season long. All right,
Yeah,
fine.
agreed.
Final one. Here's my favorite.
Mhm.
We tapped on this a little bit. Collagen supplements.
Again, if you're buying collagen to put in your coffee, then no.
Mhm. Okay, thank you. Yep.
Um,
Collagen makes its way into everything now. It's
yeah,
it's
so
the new creatine. Yeah,
it's a delicious coffee creamer,
I hear
but
good
it's
things. Yeah.
that's what it is. It's a very expensive coffee creamer. Um, there was a study that showed that when you take a collagen supplement close to caffeine, that it decreases the fibroblastic ability of you're not
Metap-
making collagen. So
Metabolism. Yeah.
I would say collagen supplements, yes, as long as you're not taking it with your morning coffee and or a few hours away from your caffeine consumption.
Sure. Thanks for being a part of this show. I think
Thank
it's
you for
always just
having me.
fun. Yeah, I was like, it's fun to have your own girl gang of fitness folks. Don't forget to like and subscribe because these are the conversations we have. It's fun, it's inviting, and it's what do we call it? Edutainment. Yeah, it's edutainment.
I love that.
Join us next week. Shara, thanks for being with us.
Thank you so much for having me.